10 to 7, the simple ideas are often the best, they say. And here's proof. A study in the British Medical Journal suggesting that a face drawn on an inflated rubber glove is a good way of distracting children from pain when they arrive at a hospital accident and emergency. Eoin Fogarty is a specialist registrar in Pediatric Emergency Medicine in Dublin. Is on the line. Good morning.
Good morning.
What do you do?
What do I do? Well, what I've been doing for a number of years is taking a simple standard hospital glove, blowing it up and drawing a face on it and using it to distract kids with acute pain. And like you said, recently I did a study and I showed that when you draw a face on it in a Jedward style, it'll be better than drawing it in what's called a Mohawk style.
Yeah, okay, so describe the difference between them.
So in the Jedward style, you draw the face on the palm. So the 4 fingers will look like their hair as it goes up. The alternative way, the Mohawk, is where you draw the face around the thumb, with the thumb representing the nose.
So then it's got one sort of spike in the middle.
It's got one spike like a Mohawk. And essentially, the Jedward one is better than the Mohawk one.
Now, why would that be?
I'm not sure, because I did something similar with the house doctors, with the paediatricians, and they seemed to think it was the Mohawk version, and to be honest, I thought it'd be the Mohawk. But kids just seem to like the visual appearance of the Jedward version.
I suppose there's more to look at, isn't there? There are more spikes, there's more hair, there's more going on.
Yeah, that must be it.
Because, I mean, on the face of it, it is ludicrous, actually. But this is a serious study. I mean, you did it in sort of semi-serious conditions, and you do seriously think that it works, that a child who is shown this very simple device, if I can call it a device, will need less medication, will be happier and easier to treat.
Absolutely. I mean, historically, we've been pretty bad at treating kids with acute pain. We're getting better, and it has been shown that if you give them distraction tools of any description, that you reduce the amount of pain relief they'll need, and it'll help them on a psychological basis in their journey through the emergency department.
And you're convinced that this is the best way of doing it? Because people will try, I don't know, mobile phones or bits and pieces or dolls or anything they can find. But you think there's something about this thing that they can touch and look at and fill about with?
Well, usually when I do it, I draw the face in front of the kid and I blow the glove up in front of the kid. And there's a little bit of a hoo-ha with that. And, I point at the kid, what's this? And this is your nose and this is your hair and that kind of thing. And when I ran the study, I showed that 91% of kids will go for it. They'll actually go and play with this glove. So I think that's, pretty good efficacy.
Eoin Fogarty, thank you very much.
Thank you.